Hello and welcome to another Tuesday Talk with Ruby Reese. My name is Killian. I'm co-founder Ruby Reese and I will also be your host. This is going to be the very first episode that's coming out in 2025. So first and foremost, we at Ruby Reese would of course like to wish you all a very happy new year and all the best for 2025. We are delighted to be launching into the year with another podcast episode, and I'll shortly be introducing a special guest. Before we launch into that, I'd just like to reiterate a quick point, and I'm sure I've made it before, but it's good for our regular listeners to know that we sometimes play with space and time on this podcast, and I think this is a perfect example. We're just beginning the new year, and around Christmas time, lots and lots of us, including us at Ruby Reese, have been extremely busy. So we often will have recorded a podcast weeks or sometimes even over a month in advance, and it's not us stockpiling podcast episodes. It's so that we're prepared for the future, for when everyone is super busy, that we still have our content all ready to go and prepared. On top of that, there are some other things as well, not just time wise, but also things like editing these episodes, although we try not to cut out lots and lots of content from them. We like to keep them as natural as possible. Sometimes there is some editing needed so that they fit into the format that we have, and it just makes things run an awful lot smoother. We are delighted to have brought out 26 episodes last year, starting in July, and bringing out an episode every single Tuesday from the time we began. So with that aspiration for 2025, we hope to bring out 52 episodes, one every single week, and we can only do that if we're recording some episodes in advance. So without further ado, I am delighted to introduce a really, really exciting topic. It's a very specialist veterinary topic this week, but one that will affect lots of us that are pet owners and dog guardians throughout our pets' lives. I will be speaking with Lisa McAuliffe, who is better known as the Pet Eye Vet. You can find her at petivet.ie. And without further ado, I think I'm going to now let you listen in to the chat that I had with Lisa. Lisa, welcome to the podcast. Thank you very much for coming on and joining me.
You're very welcome. I'm delighted to be here.
Very good. And would you do us the pleasure of introducing yourself briefly?
I will, of course. My name is Lisa McAuliffe. I am from the UK originally. I've been in Ireland as a blow-in for probably nearly 18, 19 years. And I run Pet Eye Vet, which is a clinic in Middleton, based in Middleton. And we look after dogs, cats, donkeys, horses and exotic species, mainly with eye conditions. And we see people from all over Ireland. And I've been doing that probably for about 5 years now. We run out of the vet clinic in Middleton. And I also do clinics in West Cork and up in Meath as well. So we get about looking at different patients with eye conditions.
Brilliant. That's really, really interesting. And thank you so much for the introduction. So you already partially answered my question. You mentioned a couple of animals there, but what species do you look at? I know we obsess a little bit about dogs on this podcast, but just to hone it in, it's not just dogs you look after, right?
No, that's a healthy obsession, dogs. But we do dogs, so we do cats, rabbits, exotic species. Like I say, we look after the donkeys at the Donkey Sanctuary. We're over there a fair bit. So a variety of species, but on the whole, dogs and cats. Yeah, they would be our big ones that we see.
Brilliant. And talking about symptoms, so I'm sure there's lots of people listening in now that might have dogs that have eye problems or potentially. How can dog owners generally recognise the early signs of issues of particularly around the eyes of their pets?
I think from a symptom point of view, one of the things that gets missed a lot is eye discharge. Dogs and cats will often have a little bit of discharge, or what we would call sleep sometimes there. And sometimes they can have that for a few days or a few weeks, or it can be even quite chronic, it could be several months. And if someone comes in and says, I'm cleaning, and I'm maybe cleaning their eyes in the morning and the evening, and that might be normal for them to do that. But for me, that's a little like warning sound. I don't know. Okay, well, how often? What color is that discharge? Is it accompanied by them sitting there kind of with one eye closed or the other eye closed or both eyes closed? Are they uncomfortable? And they're sometimes the first signs that there might be something niggling.
And to do with discharge, is any amount of discharge kind of a normal amount of discharge?
That's often related to the patient. So
Hmm.
some dogs will have lots. They might have sort of streaming looking eyes, and tear staining that's associated with it. And that again might be normal for them, but I'm looking at the abnormal, if
Hmm.
you know what I mean.
Yeah.
And the majority of dogs that come in for their vaccines and things like that, if there is staining there, that makes me want to go looking for like what could be causing that as a problem. Discharge colors vary as well. So a lot of people will see that brown crusty bit there, and that's often comes from tears which have dried there. So a little bit of that I don't mind. But if it's kind of mucousy or mucoidy, or I like to sort of say the word eye bogies, if you've got that going on, I want to look a little bit closer at their tear film, maybe quantity and quality, and also how do their tears go down their nose, their plumbing. So what might look fairly innocuous and they're just cleaning once a day might be the start of a tear film problem, for example. So they're often things which we overlook because it's not causing any discomfort.
Hmm. And you mentioned kind of a buzzword there. You mentioned about tear staining. So we're going to have to ask about that as well. Is there a silver bullet? Is there a simple answer to what's causing tear staining? Or is this a kind of a larger, maybe, kind of group of problems?
I think it needs investigating because there,
Hmm.
there's certainly lots of things on the internet these days that you can easily buy, and you might spend a lot of money trying to get rid of what is aesthetically, to some people, not an acceptable thing. If you've got a white or cream colored dog, you maybe don't want these big brown stains here. And that's just tear staining, but it's not easy to get rid of if anything gets rid of it. And it really does warrant a little bit of further investigation. For example, um, finding out what the tear film does in that patient. Does it sit there? Does it go down the nose like it should do? Sometimes it actually goes down the back of the throat. Or most animals are making the right quantity of tears. It's just that it can't get down those. So the waterworks, their plumbing, is not quite right. Or they've got little hairs which are tickling the tear filament, some microscopic ones that you can't see, but yet we see with an examination. And if they're tickling the tear film and causing the eyes to water a bit more, that can produce this tear staining too. So all of those things are more mechanical problems or sometimes physiological, but there isn't a magic bullet, unfortunately, that you can get through a lot of magic bullets before you actually probably realize that nothing's going to get rid of it.
Hmm. And
So,
I suppose it sounds like it's a symptom as opposed to being the
mm,
actual cause, right?
yeah, it's a
Um,
symptom of it. And that symptom, just like discharge, needs a little bit more investigation.
mhm. And what other signs are we looking out for then at home?
Pain. And
Hmm.
pain is a really hard one. Ocular pain is a hard one. I did a master's degree in ocular pain, and we have obviously non-verbal patients, so we've got to take a lot from their behaviors. And when you have a sore leg or lameness, you're going to see your pet limp or struggle to get up and be stiff and warm out of it. They're, I suppose, a little bit more obvious symptoms of pain, but ocular pain is really hard to spot. And the only thing for some patients might be that their blink rate is a little bit more. And how
Mm.
many people have sat and looked at their dogs blinking? Not many, but if it's sat there with one eye closed and is uncomfortable, or this is winking at you more than the other side, that's often the first early signs, maybe of an ulcer. Um, so it's hard to spot. Pain from things like glaucoma, which thankfully we don't see too much of, is more like a headache. And humans describe glaucoma pain as a migraine that you can't get away from. Can we spot a migraine in a dog or a cat? That's hard.
Yeah.
And they're often manifests itself as a behavioral change. So they don't want to interact. They don't want you to touch their head. They maybe don't want to go for their walks. Maybe they're a little bit off their food. So it's more behavioral than actually something you physically spot with their eyes.
Okay. And is this something? Are there then secondary symptoms for something like glaucoma that people should be looking out for, or if they think that their dog could be, potentially have something going on, headachy?
Yeah. Something serious like glaucoma is something we want to see really quickly. So if they start acting like that and then bumping into things, you can lose your vision within about 12 hours of having
Oh
an
wow.
episode where the pressure goes up inside the eye. So really rapid fire kind of getting them in and examining them and checking their pressures and then starting them on medication if you can find the reason why it's happened might mean that they get back to vision and comfort and being comfortable faster. So if there's a disturbance in vision, we like to see those patients pretty quickly too. And that might just be bumping into corners or missing a step, that kind of thing. If we see patients that live in a multi-animal household, multi-dog household, that's sometimes even harder to spot because they're often using their friend to get round the place. And they might have been doing that for a little while before we noticed. So we tend to see dogs particularly earlier if they just one dog in a house living with their human because their human spots it faster. They don't have that dog friend to rely on.
Yeah, no, it's interesting, and it's interesting that some of the symptoms are, or many of the symptoms are kind of behavioral ones that we need to be watching out for as well.
They
Yeah.
often are.
And are there any other kind of really common eye problems that you want to touch on?
Really common ones. A lot of the ones we see
Yeah.
are, let's say, ulcers, corneal ulcers. They're quite sore. They're quite painful. There's more nerve receptors on the surface of your cornea than there are in the same, let's say, square a little centimeter of skin. So for some patients that really feel them, they're very sore very quickly, and they can go from a very superficial ulcer on the surface of the eye to something very deep, requiring surgery pretty fast. And I would say ulcers would probably be in the top 5 conditions that we see, along with and accompanied by dry eye disease. And that can affect lots of breeds. Let's say Westies, Cavalier, King Charles, some Frenchies, fortunately, sorry, Killian.
That's okay.
Lots of those type of breeds, Shih Tzus. We see them a lot with ocular surface disease because their tear film's not happy, and your tear film goes back to the discharge. You can have quantitative problems with your tear film, so you're not producing the right level of tears per minute, and you can also have quality problems with your tear film. And I like to talk about that as a Mary Berry recipe. So you need 3 things to make your tear film, and those 3 components have to be there in the right amount and quality, not only to stick to itself, but then to stick to the surface of the eye. And we see a lot of patients that don't have that or start with a declining tear film.
Okay. And so you started mentioning some breeds. Let's pick
Okay.
on some of the breeds here. Are there, any breeds that are particularly prone to eye problems?
Well, our brachycephalic friends,
Yeah.
and it's unfortunate, but they have predispositions to having some issues. We know. Um, Certainly they've got a degree of what's called lag ophthalmos, and that just means that they don't blink efficiently. And if you watch your brachycephalic friend, they'll kind of half blink. They don't completely close your lids. And I visited my optometrist recently, and apparently I'm a bit brachycephalic. I'm a bit lazy with my blink, and I don't remember to close my lids completely.
Okay.
And that has the effect of not spreading the tear film, which is like your screen wash on your windscreen of your car. And that keeps your cornea healthy if you spread it properly. So if you don't blink completely, that's one. If you've got a large globe and the aperture, the opening of your eye is really quite big. That allows a thin tear film to evaporate fairly easily.
Mhm.
So that can predispose them, particularly across that central equatorial part, to ulceration. And they don't have a great sensation in the middle part of their cornea, which you could say is a good thing. But it means that when they damage their eyes, they don't feel that ulcer. So they're the guys that aren't winking at you that much. They might
Mhm.
just have a bit of discharge. And they can go from 0 to 60 really fast with how bad it gets.
And the brachycephalic breeds have an unusual size kind of head and face as well, right?
They do. They've got some of them can have
Yeah,
extreme conformational issues, you know, with the skin fold here,
yeah.
and sometimes the skin fold, but also just next to it, the what we call the medial canthus here, um, will have little hairs that rub on the surface of the eye too, and they'll irritate that area, not just from the skin fold, but also from here. And some of them, their conformation just allows for tears to just run down here rather than actually go down the plumbing, the nasolacrimal duct. So yeah, there's lots of conformational issues, unfortunately, that predispose them to having problems not only with their tear film but also with their corneas.
Yeah, so that's probably presumably for pugs, Frenchies, and English
Mhm.
bulldogs in particular, keeping a good eye on those, right?
Yep, keep a good eye on those. They'll unfortunately any breed can have them, but there's something called distichia, and they're little hairs which are on the right on the lid margin, and some breeds will get those and cause them problems with wicking of the tear film, tickling the hair, and then ulceration. And some of those brachycephalic breeds get those too. Not just them, but they can too.
And are these visible to the human eye as well?
They're big enough.
They're big enough.
But if they're big enough, but on the whole, you have to use microscopy, and we use slit lamp biomicroscopy to examine the edges of the lids when they come in with ulcers, because there's so many reasons why they can get them
Mhm.
and not really feel them. That's the thing. So they might just have had a bit of discharge and be winking a little bit at you for a few days before they come to see us. And what would, if you put the same sort of size ulcer into it, let's say a Labrador or Red Setter or something, uh, they will be like, my eye is so painful I can't move.
Okay.
Whereas you might get an English Bulldog or Brachy breed come in and go, yeah, this is fine. I don't know
Yeah.
what the fuss is about.
Sure. Yeah.
And
Yeah.
that's not good.
Yeah, it makes it a little bit more difficult to diagnose. And then are there other breeds that you see quite a lot of? You mentioned Westies already. Are there
Yeah.
other guys that come in quite a bit that maybe people might need to take extra care and attention to watching
Yeah,
out for?
the terrier breeds. There's a condition called lens luxation, which are primary lens luxation, which tends to occur in sort of small terrier type breeds, and that can be an inherited issue. So they can then develop where their lens moves inside the eye and then causes secondary glaucoma and sometimes blindness too. So yeah, we see a lot of that in this country. Um, with cats, they have a lot of infectious diseases that can cause ocular problems, and sometimes they'll come just with that ocular condition, like inflammation inside their eye, which is called uveitis. They'll present with that, and actually it might be like FIV, the feline immunodeficiency virus, that's behind everything. So they present with a whole different set of scenarios versus dogs.
And because we're speaking about breed, and because you've mentioned the word inherit, I'm thinking maybe genetics play a big role in eye health in general.
Yeah, they do for sure. Um, there's a lot of conditions now that you can actually test for. You
Hmm.
can there's a good lab in America, in the States, Optogen Lab, that you can take blood samples and send them away to check if you're breeding for some of those conditions that are inherited that affect particular breeds. And not one breed is perfect, but they've all got slightly different lists of things that we look for, and now we can test for. A lot of
Hmm.
work was done in the UK at the Animal Health Trust in Newmarket, where I spent a little bit of time. Sadly, it's closed down now. But that was a great centre for breed genetic development, particularly in relation to ophthalmic conditions. So there are a bunch of things that you don't have to wait anymore to see if a patient develops. before you decide, okay, well, if this is an inherited disease, I'm not going to breed from them, because some inherited diseases won't crop up until later in life. And you can now take blood samples and send them off to see whether or not, that might affect puppies if you're planning on breeding.
Yeah, absolutely. And that would potentially be even more relevant then to certain breeds, like you mentioned, that, are kind of predisposed to having these things. And you also mentioned something interesting there about age-related eye problems. So do we see a lot of age-related eye problems in dogs like we see in humans?
We probably don't have as much data as we have in humans. There are conditions, obviously, like macular degeneration that affect humans, and we've probably all heard of things like that. In dogs, that doesn't really happen in the same way, but they do get, some of them will get senior cataracts, just as we do as we get older. I was talking recently to an ophthalmic human surgeon, and they like to let human cataracts develop to a stage and then do surgery. So they leave them be. Whereas our point of view, you get lots of inflammation happen when cataracts develop. So although it might happen in a senior patient, you kind of want to see them early and do cataract surgery on them earlier. So cataracts would be one of the most obvious age-related ones. And then there's those inherited diseases, which sometimes affect them at certain life stage periods. So, for example, there's something called progressive retinal atrophy, where they can start to have issues with either night vision and then day vision, or vice versa. And that can sometimes happen later in life. It can also, unfortunately, happen in a younger bracket of patients as well, but that can be age-related too.
Okay. And so we're talking about all these different issues that could crop up. How often should a dog have their eyes checked by a vet?
In an ideal world, every time they go for their vaccine, well, hopefully they're, going for their yearly checkup, because I know not everybody wants to have yearly vaccines, but ideally once a year. And I try and see, like, we do see first opinion cases as well. We see puppies and kittens for their first vaccine. And I suppose slightly differently when I'm seeing brachy breeds as puppies, I'm trying to get people to clean and look and observe, and maybe even put a little bit of lubrication in their eyes at nighttime as puppies, which is unusual because you go for your vaccine, you get your worming and your flea dose, and you're gone then for 12 months. But I would prefer to try and get, just like we hopefully try and get them used to touching their feet and clipping their nails and looking in their ears, just check their eyes as well, and maybe put some lubrication in at bedtime, as part of their daily routine. But ideally once a year as a minimum. Yeah.
And you already mentioned one of the steps, but what steps can dog owners take to maintain their dog's eye health, particularly from a young age, I suppose?
Yeah, but the lubrication's a big thing. Most breeds, most dolichocephalic breeds, don't need that. But if you've got a brachy breed, tonight when they're asleep watching TV, just see, do they sleep with their eyelids closed? Because lots of them don't. And they've got this little peaky bit, which is a lovely area for evaporative tear loss. So as puppies and as young dogs, if you can be lubricating them every night, that's massive. Not only does that give you the chance to make sure their cornea, doesn't matter if you sleep with your eyelids open, because you've protected it, a little bit of lubrication for overnight, but it also means that you're looking in their eyes once a day. And not a lot of us will do that. I've 5 dogs, and most of them will get an eye check before they go to bed. But that doesn't happen in everybody's household, and we don't always have that time. But if you're putting lubrication in, you're actually checking at the same time.
Definitely. And I think anyone that's listening into this podcast will definitely be checking today. Maybe not for the rest of eternity, but definitely today. There'll be lots of dogs' eyes checked now when people are listening. Very good. Yeah, absolutely. And you mentioned as well about cleaning, and particularly, I suppose, dogs that might have skin folds. Is there a best way to clean? Is there a best kind of frequency for cleaning? Is this a daily thing as well? What do you think about that?
I suppose it depends on the conformation of their face.
Yeah.
Some dogs have that skin fold that we've discussed, and they don't need cleaning. it's heading down more the dermatology route if you start to get like a moist dermatitis down there.
Hmm.
And if someone's got that, at some point, apart from seeing a dermatologist like Catherine at Skin Vet, if you've checked that out and you know why it's happening, that's the important bit, because it could be distichia, so there might be something that means that you don't get that moist dermatitis. If you've had an exam and you found distichia, and maybe they have to have a little bit of cryotherapy to get rid of those hairs, which are wicking the tear film, that stops the discharge. So it's why is it happening in the first place? But nice wipes. I think Catherine probably be able to give you more information about what the best thing to use is, but to cleanse that area. And from my point of view, I tend to suggest using a little bit of Vaseline, something inert, to try and let the tears kind of go over the skin rather than anything else. I could be corrected on that, but I would like to see, why is it developing it in the first place? Is there something ocular going on?
Yeah.
Rather than it, why have you got a secondary skin condition potentially, over having a primary eye issue that's causing you to water more and then causing you to get the dermatitis.
Yeah, definitely. And finding the root cause is obviously going to be huge. But you did mention a couple of products. Are there any other over-the-counter eye products that you recommend,
Over
or
the
should
counter.
everything be, yeah, or should everything be
Yeah,
prescribed?
I think no, there are things that
Yeah.
you can get, and most ocular medications actually are human, because
Hmm.
there's only one or two which are actually licensed in this country for use in animals. And with the cascade system, we go for those. We have
Yeah.
to. But they're prescription. Over the counter stuff for humans, from an eye lubrication point of view, there's plenty of nighttime ones that I suggest. So there's something called Xalin Night Ointment. I use it myself. And that's like a thick gel-like ointment which hangs around on the surface of the eye. It's really useful for those brachy patients at nighttime if you're going to put something in, and that's over the counter. But you want to have gone out for your wheeze and poos and last walks before you put it in, because as I know, when I put it in, I can't see anything. So I
Okay.
put it in, I get into bed and I put my own stuff in, and then I stay there. And there's no getting up for a bit, because I'll be like this. You can't see anything. It's a great lubrication for patients who are blind, and have a tear film problem, because you can put it in and they don't need to see, or they can't see. But that's over the counter. That's nighttime stuff. And Hylo, there's a Hylo Forte for during the day. Sometimes for some patients you can use that as well. Um, there's a good cleanser, which is probably the only thing I'd use to cleanse this area if you do have tear staining. And that's called Ocral Cleanser. I don't know if yeah, I know it's over the counter, but you can probably get it at your veterinary surgeons, because it's a veterinary product, but it's not a prescription medicine. So, and that's quite good. It's allows you to cleanse this area. It's like a blue colored solution. It doesn't get rid of it completely, because, like I say, you kind of have to work out why it's happening in the first place.
Hmm.
But it's probably the only thing I would say to use to clean that area. It's very
Okay.
safe if you get it in the eye as well.
Yeah. Which is also going to be a huge concern, presumably, if
Mm,
you're dealing in and
yeah,
around the eyes.
yeah.
And talking kind of on a similar line, are there any specific diets or supplements or nutrients that really help support healthy eyes in dogs?
Um, most of the veterinary diets will claim to have something in them that helps with that. And so as long as you're on a balanced diet, you should be getting everything you need.
Hmm.
Um, there's one supplement made by a company in America. It's made by veterinary ophthalmologists in America, called OcuGlow. And
Hmm.
again, you should be able to buy that either direct from them or on the internet somewhere. And that's got lots of healthy eye supplements in,
Hmm.
that allegedly claim to help ocular retinal health, particularly. It doesn't slow down any of the retinal diseases, but we know that when, particularly with PRA, that progressive retinal atrophy we talked about, we know when that happens, there are little toxic metabolites released into the vitreous, which is the back part of the eye.
Hmm.
And just in front of that is the lens. So we know that the lens gets lots of its nutrition from the area around it. And so if things change around it, the lens starts to change
Okay.
and become a cataract. So if you can help with anything, those supplements, Ocuglow, are claim anyway to help with the ocular health and reduce the amount of little metabolites. It's hard to tell if you've got a patient taking them. Is it slowing anything down? Is it making it better? But I do believe that you can't do anything wrong by having a patient on those supplements to help. The other one, which would cause a group of ophthalmologists to probably fight among themselves, is L-lysine. And we use L-lysine in cats as a supplement daily if they have herpes virus. And I've done webcam productions before where we've discussed herpes virus ad infinitum. And L-lysine is debatable whether or not it helps, but again, you can do no harm by having a patient on it, and it's useful in cats that do have herpes. And as 95% of cats worldwide have had exposure to feline herpes virus, anything we can do to help, I think, is worth doing. So L-lysine as a supplement is good for them.
And presumably, if you're giving your dog like raw carrots to chew on and everything, the beta carotene can't hurt, right?
It can't hurt. It's not, like I say, you're not going to do anything wrong by doing that. Are you helping? I'm not sure, but yeah. Diet and supplements are much more important for exotic species.
Yeah.
I see lots of hypovitaminosis A, particularly cases that have eye issues in some of the chelonia, some tortoises and those sort of species. And so definitely dietary supplementation or a proper diet for those guys has much more weight for their eye disease.
Yeah, absolutely. And talking about like exciting advancements in veterinary science, is there anything currently going on? Is there any new research coming out that we can get excited about, or is it a very slow moving field? How do we feel about where things are going?
I think it's unfortunately slow, but we as ophthalmologists like to follow what the human world is doing. And I just came back from Barcelona there a few months back. There was a great conference, and a good veterinary ophthalmology conference always has a human ophthalmologist there to put their side of things, because they are way in advance of us. For example, in Barcelona, this great ophthalmologist there was talking about using actually insulin to help treat ulceration. Like it's kind of mind-blowing for us to start using topical insulin, but they're doing it in humans, and it really helps with corneal ulcers with them. So there's lots of sort of snippets of things, but it always takes a long time to filter to us, and we always have to make sure that we're trialing things appropriately too. We can't be doing harm by just trying something to see if it works for our patients. But in the human ophthalmology side of things, it's very interesting, and we're about probably 10 years behind them, but we try and follow what they're doing. And does that work? And can we try that? Even from techniques as well.
Yeah, no, that is really exciting. And are there any maybe common myths or misconceptions about dogs' eye health that you'd like to address?
I suppose it goes back to the old discharge.
Yeah.
Yeah, discharge is not always normal. And bumping into things is not always normal. Or if they've never had great vision, well, why have we not had great vision? I'd like to have a look. And yeah, there's lots of stuff out there that claims to help. We've discussed a few things, and they don't really. There's nothing that I think, as an ophthalmologist, can take from a really good exam that will allow you to work out what's wrong and give you a plan. And then you can go away and decide what you want to do. But I think a good investigation means that you'll find anything and everything. And some of those things don't need treating, but some of those things do.
Yeah, definitely. That's amazing. Thank you, Lisa, so much for coming on and sharing. I know there won't be a dog's eye that isn't checked out this afternoon or evening or whenever people are listening in. Thank you so much for coming on and sharing. It's been a pleasure.
You're very welcome, Killian. I've really enjoyed it. Delighted.
Me too. Thank you so much.
Thank you.
And once again, a huge thank you to Lisa for coming on and joining me on the podcast this week. If you'd like to help this podcast out, you would be doing us a huge favour if you gave us a like, follow or subscribe wherever you're listening to this podcast. If you'd like to find out more about what Lisa gets up to, or indeed what we at Ruby Reese get up to, you can find our social media handles as well as our websites in the show notes. We have a super exciting new topic coming out next week, so that follow or subscribe is going to help bring that back up in your feed. Otherwise, wishing you a lovely week and hope to see you again next Tuesday. Thank you.